Good morning. Iowa continues to experience a decline in COVID-19 cases, positivity rate, and hospitalizations. Over the last 14 days, the statewide average positivity rate was 12.6%, and only 32 counties had rates of 15% or higher. Over the last 7 days, the statewide average positivity rate was 9.5%, and just 11 counties had rates at or above 15%. 88 counties are below that. During that same time frame, Iowa ranked 35th nationally in the number of new COVID cases and 39th in its average daily case rate per 100,000 population. Hospitalizations continue to trend down and are approaching pre-November levels, and 81% of all Iowans who have had the virus are now recovered. Cases in our long-term care facilities have also shown improvement, with cases among long-term care residents decreasing and staff cases are stabilizing over the last 4 weeks. Finally, as of yesterday, more than 8,400 healthcare workers have been vaccinated in Iowa, and all doses that were allocated for last week's shipment were received as scheduled. There's also good news coming from Washington, D.C., where Congress finally passed a new $900 billion relief package to support American families and businesses, which now awaits the president's signature. In addition to direct payments, additional unemployment benefits, and more funding for forgivable Paycheck Protection Program loans, the package also provides support for vaccine funding, education, broadband, and more. The bill also extends the deadline for states to use their coronavirus relief fund allocation through the CARES Act by 1 year until December 31st of 2021. This will allow us to put Iowa's remaining balance of about $47 million to work in programs that will continue to make a positive difference for Iowans. This weekend, yet another important milestone in our nation's COVID-19 recovery occurred with the FDA's approval of the Moderna vaccine. The addition of the second vaccine will increase the number of doses that are immediately available for the first phase of vaccinations, and it will keep us moving forward. Distribution of the Moderna vaccine began immediately upon final approval Friday and started arriving in Iowa yesterday. Because the Moderna vaccine does not require ultra cold storage, it's able to be distributed to rural areas across the state. All 99 counties are receiving an allocation of the Moderna vaccine in this first shipment and will continue to receive it going forward. Today, I am pleased to be joined by Jason Harrington, President and CEO of Lakes Regional Healthcare in Spirit Lake, where they're expecting the arrival of the Moderna vaccine today and planning to start vaccinating hospital staff right away. Jason, thanks for joining us today. It's certainly an exciting day for your community and, of course, for your hospital staff. Tell us what this means to everyone.
Yeah, Governor Reynolds, thank you for having me. Certainly an exciting day for a lot of rural communities, including ours. We're expecting our shipment to arrive, could be during this call, actually, so around noon. We're expecting 300 doses, I think is what's been indicated, and we're expecting another 200 doses next week. So the intention of those, of the first tier, first wave of vaccinations is really aimed at healthcare workers, as you suggested earlier. The Moderna vaccine, other than not having to be ultra-frozen, the other issue with the Pfizer vaccine in rural communities is it comes in lots of 1,000. The Moderna vaccine comes in much smaller lots, and the logistics of trying to, in a rural community, get 1,000 doses out in a relatively short period of time is difficult. So Moderna has actually two positive effects on rural communities. So we're expecting 300 today, 200 next week. Our first tier, and I was really excited about this. We did an internal survey of our staff to see who would be willing to take the vaccine if it were offered, and we had a 75% affirmative response rate from our staff. So we were very pleased with that. So the plan locally is to vaccinate what I would consider patient-facing healthcare professionals. In my particular hospital, that would include, obviously, physicians, nurses, housekeepers, food service workers, receptionists, anyone who comes face-to-face with patients throughout the day would be in Tier 1. Tier 1A that I'm going to call that, once that group is vaccinated, which we hope is certainly very shortly, we intend to start giving the vaccine today. We have a vaccination clinic tomorrow. There's 260 openings for that clinic. So very excited about that. But so Tier 1A then is patient-facing healthcare providers in the community. So that would be people like ophthalmologists and pharmacists and dentists and those types of providers, dental assistants, and their patient-facing staff, receptionists and dental hygienists and those types of things. Once that group has been vaccinated, we'll come back to the hospital and do the non-patient-facing staff, which would include folks in the business office. Again, physicians that aren't directly interacting with patients. We'll go back out to the community and do that to those healthcare providers as well. Our hope is that by next week that we've vaccinated the vast majority of healthcare providers in Dickinson County, and then can move on to phase 2, which my understanding will include firefighters, teachers, law enforcement, and so we're very excited about and lots of excitement around here about our ability to move forward with the vaccination. Lots of support. Have been very. I need to acknowledge Governor Reynolds and the state for their support, not just in getting the vaccine out in a timely manner, but we've partnered with the state on our Test Iowa clinic. We've tested 12,000 Iowans in the time we've had the clinic. The state's been very, very responsive in getting out outpatient therapeutic medications and Bam and Regeneron to prevent hospitalizations, and we're grateful for that. And we have some additional staff due to the state's support. So we're grateful of that. Like in many communities in Northwest Iowa, we've seen a spike late in the year. Our numbers are trending down, as the governor suggested. Unfortunately, our inpatient numbers are trending up due to some spikes in nursing homes and assisted living. And certainly the vaccine will take us a long way in our fight against COVID, and we're grateful for that. And we're excited to start vaccinating members of our community very, very soon.
Well, thank you. That is a great update, and I think that's demonstrates what is happening in rural Iowa across the state. So we wanted to show how our rural hospitals are receiving their allocations of the vaccine and kind of how they're planning and moving forward. So I know a lot of work has gone into today, and I want to just thank you and your colleagues for working with your local public health department and the state to coordinate this important effort, and really for everything that you've done over the last several months to care for your community. And as you mentioned, including the Test Iowa Clinic. So I really appreciate that very much, and the numbers and the therapeutics and all of that. It's just been a real coordinated effort between all of us. So thank you very much for your role in that.
Yes, you're welcome. Thank you.
Thank you. As you saw last week, the federal government notified a number of states, including Iowa, that vaccine allocations would be less than what was initially projected. And this set off a confusing chain of reactions across the nation, including right here at home, causing some widespread concern that we wouldn't be able to meet the immediate vaccination needs of Iowa's healthcare workers, and speculation that the state would delay vaccination for long-term care residents and staffs. So even as we were still gathering more information about the situation, our intent was to find a way to continue moving forward as planned with the priority groups, understanding that some changes would likely be necessary. Throughout last week, the Iowa Department of Public Health remained in very close contact with our federal partners to determine how Iowa's allocation would change and what adjustments would need to be made to our vaccination plan as a result of that. Then, as I'm sure you're aware of, over the weekend, General Perna, Chief Operating Officer of Operation Warp Speed, apologized for and took full responsibility for an unintentional planning error that caused vaccine doses to be incorrectly over-allocated to some states. As I mentioned last week, deploying Iowa's vaccine strategy has been, and it will continue to be, a monumental effort. This is true not only at the state and local level, but at the national level as well. There are bound to be some bumps in the road as we head down this new path and move forward. So it's important, I think, to keep in mind that while receiving less vaccine than initially estimated is disappointing, it doesn't change the fact that at this very moment, Iowans are being vaccinated, that 2 vaccines are now available in the U.S., changing the course of the pandemic as we speak, and that within a matter of just a few more months, the vaccines will be more widely available and life will begin to return to normal. Just as we saw months ago when we launched large-scale testing through Test Iowa, it takes time to ramp up and for things to run smoothly. We'll likely experience the same as we begin broadening the scope of vaccinations across the state of Iowa as well. I think we owe it to each other to assume good intent in these efforts and to give each other some grace while we navigate yet another new phase of our recovery. Due to the decrease in allocation, the federal government is allowing greater flexibility in our participation in the long-term care pharmacy partnership by reducing the minimum threshold of vaccine required to begin participation in the program. So what that means is that we'll remain on schedule to start vaccinating long-term care residents and staff the week of December 28th, and we've also activated our participation in a similar program for residents in assisted living facilities. Additionally, this week, the CDC's Vaccination Advisory Panel recommended that the second phase of vaccination should prioritize adults age 75 and older and frontline essential workers, including first responders, teachers, and those who work in manufacturing, food, and ag. The Iowa Department of Public Health and Department of Human Services Director Kelly Garcia is again with us today, and she will provide more details about the steps that she and her team have taken to adjust Iowa's plan since learning of the change in our vaccine allocation and the role that the Iowa Disease Advisory Council will play in guiding our planning and decisions for upcoming vaccination phases. Kelly?
Thank you, Governor, for having me again today. Good morning. I'm delighted to share with you an update on our state's vaccine distribution. As the Governor shared, more than 8,400 vaccines have been administered in Iowa, and more are being administered daily. In fact, this number is most assuredly out of date as I speak. You likely saw the FDA has approved the Moderna vaccine, which adds an additional tool to our phased distribution. It's arrived in Iowa, and we're on track for distribution this week and next. Healthcare settings, including hospitals and clinics, will receive shipments directly as allocated by local public health authorities in partnership with our department. You may recall the Moderna vaccine, as the Governor mentioned, does not have the ultra-cold storage requirements, which does allow for further reach into rural spaces of the state. We also learned some new information and other key differences from the Pfizer vaccine that I'll mention. Moderna has been approved for individuals 18 years and older, whereas Pfizer was intended for 16 years and older. Another distinction is that the 2 doses of Moderna are to be administered 28 days apart instead of 21, with a best practice range of plus or minus 4 days for the booster shot. The Federal Advisory Committee on Immunization Practices, ACIP, met again to provide further guidance. While we continue on our path to vaccinate the initial priority groups of healthcare professionals and long-term care residents and their direct care staff, ACIP is now looking at the next groups. Phase 1B will prioritize frontline essential workers and individuals aged 75 years and older. Phase 1C, which includes adults aged 65 to 74 and individuals aged 16 to 64 with high-risk medical conditions, such as individuals with intellectual and developmental disabilities, autoimmune disorders, or other serious underlying health conditions. However, to be clear, and as the Governor mentioned, we're still in the early stages where our efforts are focused solely on healthcare workers and long-term care settings. Iowa's version of this group, the Infectious Disease Advisory Council, or IDAC, continues to meet and in fact met yesterday, where they discussed and identified potential groups to prioritize that were not included in the ACIP recommendations, such as low-income workers who may have limited access to health care and be at high risk due to workplace setting and other social determinants, individuals experiencing homelessness, individuals with disabilities, whether in congregate settings or otherwise, and community-based spiritual workers. The Council discussed the possibility of subprioritization of frontline essential groups identified by ACIP. They also discussed the need to use data-driven subprioritization recommendations, which includes looking at disease trends, vaccination uptake, and vaccine allocation projections. We'll continue to provide updates on their discussion, post their meeting minutes, votes, and final recommendations. And to date, I've accepted all of the group's recommendations in full. Regarding our allocation numbers, we will continue to provide updates if there are changes, though right now we appear to be fully on track in the total number we provided last week. In fact, my team right now is meeting with the CDC to confirm that that's the case. We've been in close communication with our federal partners, speaking with them daily, and over the weekend, General Perna, as the governor mentioned, released a statement about the change in allocation for states, taking full responsibility, and I commend him for that. Since I began as director of the Department of Human Services, I've said that in a system this large, in a system where humans are taking care of humans, we will inevitably make mistakes. But when we do, we will acknowledge them, we'll correct them, and we'll build a path forward. And we are moving forward. I'm happy to share that just as the governor did, that our long-term care pharmacy partnership program is fully activated and will go live as we originally planned next week, next Monday, December 28th. Our federal partners have provided us additional flexibility for this, requiring less than the original 50% of the vaccine to be on hand to initiate this program. This flexibility is why we've been able to keep on schedule with our launch of the program, even though our initial allocations have adjusted. This additional flexibility is also allowing us to move forward, as the governor mentioned, with the National Pharmacy Partnership Program for Assisted Living Facilities. This weekend, we activated this program, and we've been given approval by our federal partners to also begin on Monday, December 28th. This adjustment provides some significant flexibility for operations and for logistics, especially when you think about the way that facilities are structured. They often have long-term care facilities co-located in one property with an assisted living function. I want to thank our team at IDPH for their round-the-clock planning efforts and their ability to adapt to change really quickly. I also want to thank our hospital partners who have kept me and the governor and our team up to date on their lessons learned as we completed the first phase, the first week of this heroic effort. But most of all, I want to thank our partners at local public health. Each local public health authority in this state has undertaken a monumental effort that is critical to our state's recovery, and they've done an outstanding job navigating this in real time. Lastly, I want to share that we also have great news at the federal level as Congress just passed the new COVID relief package. I'm happy to share a few highlights of these provisions, a little bit more detail on the human services side than the governor shared. And the bill includes, as she mentioned, vaccine funding, which is tremendous, including vaccine procurement and distribution, providing roughly $20 billion for procurement of vaccines and therapeutics, nearly $9 billion to the CDC and states for vaccine distribution, and more than $3 billion for the strategic national stockpile. The bill provides more than $22 billion, all sent directly to states for testing, tracing, and COVID mitigation programs. Of this total, $2.5 billion will be set out as grants specifically targeted at needs in underserved areas, including both communities of color and rural America. There's $4.5 billion in mental health funding, $9 billion in direct payments to healthcare providers, and $1 billion in direct funds to the Indian Health Service to carry out these services. The bill also includes $10 billion in emergency funding for childcare. These funds maintain the flexibility given to states throughout the CARES Act and can be used to provide childcare assistance to families and to help childcare providers cover their increased operating costs throughout the pandemic. The bill also includes $250 million for Head Start providers to ensure they're able to continue to safely serve low-income children and families. And finally, food assistance. The bill contains $13 billion in increased SNAP benefits to 15% above the original allotment, providing additional funding to food banks and senior nutrition programs, and ensures college students have access to SNAP as well. These changes will ensure our state continues to support Iowans experiencing food insecurity. Of course, all of these amounts are national numbers, and we're sorting through the bill, it's 6,000 pages, on what our portion will be. And this is a very exciting process. We'll keep you updated on these efforts.
Thanks, Kelly. And again, I just want to recognize the tremendous amount of work that your team has done in just the last few days to adjust our plan based on the new allocations, while also preparing for a second vaccine to arrive in Iowa and planning for future vaccination phases. It is an all hands on deck effort, and I'm so impressed, as I said earlier, with the collaboration and the coordination that's happening at every single level, from local public health to healthcare providers statewide, as well as our federal partners. So heartfelt thanks. As Kelly mentioned, long-term care residents and staff across Iowa will begin being vaccinated next week, which is some of the best news that we could hope for this holiday season. One thing was very clear from the onset of this pandemic, and that's our long-term care facilities posed an extremely high risk of infection if the virus were to be introduced there, which is why proactive planning was done early on to protect long-term care residents, and aggressively preventive measures were implemented almost immediately once the first positive case was confirmed in Iowa. It's no surprise that one of the first long-term care facilities to take action was the Iowa Veterans Home, which provides a continuum of care for veterans and their spouses. It's Iowa's largest nursing home and one of the largest state veterans homes in the nation. Their quick response and ongoing commitment to protecting their residents has resulted in some incredible outcomes. And now, with vaccinations starting next week, the Iowa Veterans Home residents and staff are looking forward to brighter days ahead soon. Here to share more about the work that's gone on there the last several months and how they are now preparing to begin vaccination is Timon Ojiri, Commandant of the Iowa Veterans Home. Timon?
Thank you, Governor. The great support that you have provided to all of long-term care facilities throughout Iowa, and specifically the veterans of Iowa, has been unprecedented. You have ensured that we have had sufficient PPE to protect the residents as well as the staff by establishing a supply chain where we receive PPE transported to our door by the National Guard and testing supplies delivered by the Iowa State Highway Patrol. We appreciate the efforts that have gone into this. Today, I want to tell you how extremely proud I am of the frontline heroes at the Iowa Veterans Home that are caring for all of our heroes. You have a team of dedicated workers who have tirelessly worked together to meet the care needs of all of our residents, even when 120 of their peers were off work due to exposures outside of our doors. Our success is because of these heroes. Staff in every area of our facility have changed the way that they do business to ensure that our residents are safe. I have never heard one staff person complain about wearing masks and goggles all day long, about being tested twice a week. It is what we do. It is our mission. The administrative team and COVID response team have met every day to ensure that our practices are current with the guidance from our partners at the Iowa Department of Public Health, thank you, Kelly, DIA, CDC, and CMS. We immediately changed how we are staffing our nursing units and how they deliver products and services from laundry, food, services, central supply, housekeeping, pharmacy, lab, x-ray, and more to ensure that the staff would not enter a residential building who was not permanently assigned there. We reassigned staff roles to provide support on the nursing units so that caregivers could concentrate on the delivery of care. We set up cuddle curtains and chat room visits so families could hug their loved ones in a safe manner. We provided daily communications to our families and changed the way that we communicate with families through FaceTime and other social media sites. Doctors and mental health appointments became virtual. We adopted and learned how to ensure that our veterans were cared for. We learned how to complete COVID testing. To date, we have run over 15,000 COVID tests. To date, we've had 21 of our 500 residents contracted the virus. Our COVID unit was staffed voluntarily, and we're proud to say that it is empty today. Some of our residents called it a 5-star hotel. What an amazing team it is. It is truly one team, one fight, one mission. Our vaccine is coming. We have partnered with Walgreens to deliver the Pfizer vaccine. Crystal Ferris, an Army combat medic served in Iraq, is heading our vaccine task force. We know that this is a great step getting beyond the virus, and our elderly population needs of all of our parts to do our part. We can't wait for our residents to spend time with their loved ones as they had prior to this pandemic. Hope is around the corner. We have never been in this battle alone. Our community made cloth face masks for our residents to wear each day. Fairway sent supplies for special meals for our residents. Veterans organizations donated snacks and iPads and much, much more. Lowe's decorated our courtyard for Christmas. And today, our local partners, JBS and Fairway, are handing out pork loins to each staff person. I cannot begin to thank every organization who stepped up through letters and Facebook notes, anonymous gestures to support us through this year. We will never be the same. We will be grateful and stronger and closer. We have served a great mission. We could not have done this without the backing of the governor's office and the expertise of our infection control. We are grateful to you, Governor Reynolds. Thank you. One team, one fight, one mission.
Thank you, Timon. Honestly, you and your team have done such an outstanding job throughout the pandemic. So thank you for your service and your service to our veterans and their families. And I want to ask you to please thank your staff for all of us. I wish them and their residents a very Merry Christmas. So thank you very, very much. Job well done.
Thank you, ma'am.
So Christmas is just a few days away, and while we're doing what we can to maintain our usual holiday traditions, they will undoubtedly be different this year, just as so many other celebrations have been. When I spoke to the state on the evening of November 16th, just ahead of Thanksgiving holiday, our COVID-19 cases were at a record highs, and our hospitals were being pushed to their capacity. I asked Iowans to be a part of the solution, to reverse the course of the virus, and you stepped up. Many families adjusted their Thanksgiving plans, smaller gatherings reduced our risk of spreading the virus, and it worked. Unlike other states across the nation, we didn't experience a post-holiday spike in new cases. In fact, since Thanksgiving, our numbers have continued to decline. We've made good progress in getting the virus to a more manageable level. We've proven that adjusting our behaviors to align with public health guidance makes a difference and is more than worth the effort. Now we have an opportunity to continue this trend and keep virus activity at a level we can live with while ensuring that our hospitals are stable, our businesses are open, and our children can return to their classrooms after the holidays. As you heard today, vaccines are here, and before too long, more Iowans will be rolling up their sleeves to be vaccinated, helping our state more fully recover from the pandemic. But until then, we can't forget that the virus is still active in our communities. So continue to social distance, wear a mask, avoid large gatherings, and washing your homes, and stay home when you're sick. For now, these simple things continue to be our best defense against COVID-19. So as you gather with loved ones in the coming days, please celebrate responsibly. Be mindful of the people that you're with and do your part so everyone has a happy and healthy holiday. Like so many of you, I'm eager to turn the calendar ahead and move beyond the challenges that we've endured this past year. 2021 brings with it a renewed sense of hope and optimism. Despite the uncertainty of the last year, one thing has always remained constant: the willingness of Iowans to come together and work toward a common goal. I want to thank every Iowan for being a part of our COVID-19 response and ask you to continue to be a part of our recovery. As we enter the new year, let's focus on moving forward together, strengthening our communities, growing our economy, and creating opportunities for all Iowans. I wish you and your family a happy, healthy, and hope-filled new year. God bless you, and God bless the great state of Iowa. And with that, we will open it up for questions.
Governor, some of the Republican legislators have indicated a willingness to using some of the state's quote-unquote surplus on pandemic relief. What will your proposal be for the legislature?
Well, I think first, Kate, we have to look at the dollars that we're receiving in the second round of CARES funding. And as I talked about some of the significant allocations, Kelly talked about what the Department of Health and Human Services and Department of Public Health will be able to utilize. So I think, we need to be responsible about seeing how we can allocate those funds, where the gaps and the barriers are at, and then see if we need to do something moving forward. But we'll continue to review it. We'll continue to look at where the needs are at, and we'll adjust accordingly. But we have to remember, while the state of Iowa really is in great fiscal health, when you consider the year that we just went through, whether it's COVID-19 or it's a drought or it's the derecho that hit a large majority of our state, we're not through COVID-19, and so we have to monitor it very carefully and continue to see what the impact is to the revenues to the state. So we need to be mindful of that as well, and if we deplete the cash reserves, we have to be mindful about how we replenish them. And so we need to just continue to see what the numbers are and see, how we're able to respond to the additional measures of COVID-19. So far, I'm really happy with where we're at, and that's a testament to the conservative budgeting principles that we had in place. Our unemployment continues to tick down, and we were one of the few states that had a surplus, and so we really are in a good position. So we do have the luxury that a lot of other states didn't have to see if there's some areas where we can fill some gaps, but we need to see what the federal dollars will be able to accomplish with those.
Governor, you noted that 8,400 healthcare workers were vaccinated. Last week, we were slated for 26,000 vaccine doses. Can you explain that discrepancy?
Yeah, I think, we've talked a lot about the reallocation and the numbers and how they've taken credit for that. And so we're going to continue to work through what the numbers look like and how we can go ahead and follow through with phase one. And so we're in the process of doing that.
Governor, I don't know if you can clarify, or maybe Director Garcia. So the pharmacists have these shots and they're going to take them basically to the long-term care facilities en masse and then start doing those, is that right?
Yeah, so the partnership that we've signed with Walgreens, CVS, and community partners, they will not only be distributing, but they will be administering the vaccinations to the long-term care residents, staff, and now with the flexibility, because of the reallocation and the number of doses that we were supposed to receive, they have provided some flexibility. So as Kelly indicated, it actually, a lot of the facilities have the long-term care and the assisted living on one complex, and it'll allow us to be more strategic in how we implement the vaccine, because they'll be able to do it with one trip instead of going back at another date. So I think actually it'll streamline the process. And I wanted to let the media know that when we come back, we have reached out to some representation from our pharmacies to actually participate in the next press conference that we have, so that they can walk through how they are going to implement the long-term care pharmacy partnership that's in place with the federal government.
And then follow up, and then is phase 1B with the 75 years or older and frontline workers, has that been approved or has that just been discussed?
I believe I heard Kelly say the recommendations had been given to her, but they are still going. Okay, I'm going to have Kelly answer that because I don't want to mix it up. But that is CDC's guidance. It's not ours.
That was correct. Okay. So there are recommendations provided at the federal level through ACIP, and now IDAC is sorting through that. You'll see, and there's a slide presentation available on CDC's website, which I'd be happy to point you to, that kind of outlines at a high level the categories. And so now IDAC is really thinking about, does it need to be further sub-prioritized, or are there individuals missing in that list that might be Iowa specific, like meatpacking plants?
Along those lines, Director Garcia, is there enough doses expected to just cover that whole batch, or are you saying you may have to kind of rank within? Okay.
Correct, yes. It will take some amount of time, and we have numbers for some of these industries that allow to guide us exactly how long it will take to roll out in those particular industries, and we're working to gain some more clarity in some other spaces.
Director Garcia, with that 15,000
keep you
discrepancy,
updated as we work through that. So, we have to, as I said, we have to show some grace, because there has been some movement, but I think we're all focused on accomplishing the common goal, and so we'll try to keep everybody up to date on what those look like and what those numbers are.
Governor, can you kind of in the simplest way explain your administration's communication with the Trump administration about the reduction of our vaccine supply? I think it's about 20% there.
Yeah.
Just sort of in layman's terms, can you explain why we're not getting as much as we had hoped? And then do you expect us to catch up down the road, or does it just kind of delay immunizations 20% until we eventually get everybody who wants one?
So I have not personally talked to him. Kelly and her team have had multiple conversations, and they do it on a daily basis. But I think, as I indicated earlier, General Perna stepped up this weekend and took full responsibility for the reduction, and I think it was about a couple dozen states that had been impacted. He had unintentionally, there was a planning error, and so they had sent the wrong numbers. They had incorrectly over-allocated for the number of doses that about 24 states were to receive. So as we learned that, and as we were told what the new allocations would be, in addition to that, with the reallocation of the numbers, we also were given some flexibility, which has allowed us to go ahead and kind of move forward. We weren't sure at first, Dave, if we were going to be able to even start the long-term care facilities the week of the 28th, but because of the flexibility and not having to hold back a certain percentage to kick the partnership into effect, we were able to go ahead and start long-term care facilities the week of the 28th. So we're adjusting, and I think we'll learn more as we move forward. And as I said, we'll be sure and keep you all informed as to what those numbers look like and how we respond to working through phase 1, and then, as we move into phase 2.
We got one question coming on the phone right now. Governor, what's the plan to convince groups who are suspicious of the vaccine to take it?
Well, I think, we've had a lot of people on, Brooks Jackson. We've had a lot of individuals, the Vice President, the First Lady, the Surgeon General are taking the vaccine. It's safe. And so we're going to encourage people to take the vaccine, and we're going to start a communication effort, kind of do some different PSAs and talk about how effective the vaccine is. So we would encourage people to take the vaccine.
Yeah, just wanted to check with you to see how firm are you going to be about making schools come back into session. We've seen a number of schools request to go online for a while.
Yeah, actually, that's completely gone down, and our trends are moving in the right direction. I think I've made it pretty clear as I'd be on the side of the parents and the students, and we want to make sure that we do it safely and responsibly, and I believe we can. I believe the data supports that. The kids need to be in school. There's for so many reasons, and I've gone through it multiple times. Right now, so it's going to take legislation. That'll be one of the number one priorities as we move forward. But we need to get the kids back in school, and we need to recognize that the majority of the school districts are doing that.
Are you willing to? I think the CDC has come out with a report that would indicate many school districts would need tens of millions of dollars to. Yeah. For the extra PPE, for the cleaning, for
Actually,
extra staff.
Actually, they have the PPE. I talked to them
Are
a
we
lot.
willing to do that in Iowa?
There's funding in the New CARES 2.0 or whatever it's called that includes funding for that. They have the opportunity, if they need additional, if they're not in the school, then they're not using it, so they should have some PPE available. We did one allocation and then told all the school districts if they needed additional PPE, all they have to do is request that through Homeland Security. In the calls that I've made to the various superintendents and school districts across the state, in fact, I haven't had one that has indicated to me yet, now that could change, that they're setting good with the supplies and with the PPE, and I remind them that there's not just an automatic allocation going out, but if they need additional PPE, they have to, what the procedure is for doing that. So I think there's additional funding in the CARES. We're still kind of unpacking that to see what that looks like, but the stockpile that we have in place out of Homeland Security is significant, and so we want to be sure and be a partner in helping do whatever we can, just like we did with the long-term care facilities, David, in providing them 30 days worth of PPE so we can get them stabilized, get the numbers to where they need to be, so that we can until we can get them the vaccine. So we'll work with them in order to get that done. Thank you.